Okay, well, good afternoon. Welcome again. I don't think we were necessarily expecting to have a further media briefing today, but quite a number of developments that are worthy of briefing this afternoon. I'm conscious, having received feedback via social media, that I need to be more brief in my introduction, so I will get straight into it. And further restrictions are being announced, unfortunately, as a result of the COVID-19 situation. From 6:30 p.m. today, nightclubs will have to close. Bars that do not serve food will also be closing. And pubs and restaurants that serve prepared and plated food are also expected to take a very responsible attitude in relation to their handling of their clients. Sorry, forgive me a second. Thank you very much. Let's come back into life. I think it's worth technology. I think it's worth emphasising that we envisage this as being as a temporary measure. Very much as we talked about yesterday in relation to schools, the concept of pause and assess, and again, Dr. Brink will explain some of the rationale behind the decision that we have made today. Restaurants and pubs which do serve food will need to observe these new restrictions, which will mean that alcohol can only be served at tables and with prepared or plated food to customers that are sat at the table. Now, some residents of the island will well remember that this was basically the way that the island used to operate on Sundays, and it's some of the rules that actually apply on a Good Friday. So it's using, if you like, a tried and tested methodology that the island has been used to in the past. These temporary measures will be reviewed in 10 days' time, and they are part of the response that we talked about yesterday to delays in receiving the results for coronavirus, and we can talk a little bit more about where we are in results and our access to tests as well, as ever things continue to move. Efforts to resume the timely testing through the UK have been encouraging, and there have been some improvements in the last 24 hours, and test results will be coming back, are coming back, and we expect some of the backlog to be cleared as well. And work to, again, reiterate the work to introduce on-island testing in April is also continues to advance well. As we stated yesterday when we made our announcement on schools, we are in a position where it frankly has become less clear over the last week or so to what extent coronavirus may be spreading within the community, and we will not take any chances. And bars and clubs do present a very real risk. We're very conscious that a significant number of students have returned to the island. They've come from the UK, where only a few days ago they were it was part of the social fabric of an expectation of life within the UK, and the UK student universities and establishments that they would be out and about. Life has changed very rapidly for lots of people in lots of places, but we need that culture we need everybody to accept that the culture needs to adapt very, very quickly here, and we're not prepared to take any chances that anybody who has come back to the island, even if it was before the mandatory self-isolation period began at midnight on Thursday, that they do not understand their obligations in relation to being out and about. Now, we do understand that this is going to come at very short notice to licensees, but I'm afraid I'm not going to make any apologies for us taking swift actions to protect our community. This is, as we all know, a very fast developing situation, and we are having, frankly, to react in real time. We believe we've come up with a proportionate solution given the circumstances, and frankly, we expect licensees that they must not only respect the new legal restrictions, but also the reasons we are introducing them. And I think one of the things that has driven us to this decision is we have become aware that a number of licensed establishments frankly have taken quite an irresponsible attitude in terms of responding to this crisis. And also we're well aware that a number of young people have been planning to take the opportunity to go out tonight as the end of term, obviously with term having been brought forward the end of term having been brought forward as a result of yesterday's decision, plus the return of students from outside the UK. So we are very much responding to the community's response, and I'm going to come back to that as well in terms of our expectations of the community. And really what we are saying, quite frankly, is that we actually expect everybody, customers and licensees, to be following the spirit, not the letter of the law. If there's anybody out there who looks at this set of restrictions and thinks, okay, how can I get around this? What can I do to get around these rules? Then frankly, they have completely failed to grasp the severity of the situation which this community is faced with, and our determination to act and protect the wider interests of the community. We will have absolutely no hesitation, and I think we've demonstrated our determination to do whatever it takes, as I've said before, to continue to introduce stricter and stricter and more prescriptive rules if we judge that it is the right thing to do. We don't want to be doing any of this, and as we've said several times this week, we want and need, so far as possible, as many businesses as possible to continue trading for as long as it is possible and safe for them to do so. But it is entirely dependent on everybody in the community understanding their serious level of responsibility to minimise the impact of this virus. Young people, the 18 to 30, 18 to 35 age group, are not immune from this disease. And again, Dr. Brink can talk about the experience from outside the island. But also, even if they were immune, which, as we've said, they're not, the responsibility to their fellow islanders, people they either know or don't know, is the reason that everybody needs to take this very seriously. And that's what today's measures are all about. It's about reducing contact between individuals and to support the social distancing recommendations. The reality is that a nightclub, by definition in terms of its role, is not about social distancing. It's about social proximity, about bringing people closer together. So it's a very difficult environment, particularly when you put alcohol into the mix. So that is a fairly significant change which I wanted to talk about. What we're going to do in terms of the lineup today is Heidi will speak a little bit further in a moment on that issue. We also obviously have the latest update from Dr. Brink. We have the opportunity for questions for Jason Moriarty in relation to some of the issues around the implications of bringing the end of term forward and how that's being managed, particularly in relation to childcare for essential workers. And also we're pleased to have Ruari back again to talk about not only obviously enforcement at the borders, but also there may be some questions arising about the enforcement issues which arise from today's measures as well.
Nightclubs are closing. Gavin made very clear the reason behind that, but bars that can serve food and people can sit down, and restaurants are remaining open, but we are making sure and asking people when they visit the pubs and restaurants to maintain the social distancing. It's really important you do so we prevent the spread of the virus as far as possible. I hope everybody understands that by now. This is a serious issue. It is affecting everybody, and Nikki will give more information on that. It's not just the old that are going to be affected. I think a lot of young people have been thinking, oh, it doesn't matter for us, it's not going to affect us. More evidence is showing that might not necessarily be the case, so we've all got to be vigilant here. And anyway, we should be doing that. We should be supporting all of the community, because we're all in it together here. So the interesting thing is we've been looking at a solution from the past as a solution for the present, and I think that's a really interesting way. We're looking at things that are appropriate for Guernsey all the time. So again, I will reiterate how people need to understand and the messages and what we're trying to do here, and not think and ask about, well, why are they doing it in another jurisdiction and not doing it here? So again, that's a message I want to reiterate. And also I'd like just a word to students. So it's been a really traumatic time for them. I know from a personal point of view, it's in fact impacting our family and students not knowing whether they should come home or stay where they are, knowing what their exams are being messed around. So it's a really difficult time for them. This is to say that we all understand that. Everybody wants to make everybody's life easier, and that will happen. But at the same time, students, please understand why we're doing the measures today, because it is to support the whole community. And this, in the long run, in the whole scheme of things, you will be grateful that you did the right thing and not go out and try and go out with a bunch of mates and have a whale of a time now, because it might not may be very different in a few months' time. So that's really the essence of what we're trying to do now. I would just like to pick up on, in terms of the testing equipment. I did tweet earlier a picture of the first bit of kit that we've got. We're absolutely delighted. It's in the new Path Lab, waiting to be installed. That's the extractor. And the other piece of equipment, the cycler, is on its way. We've got the shipping details now. It's on its way. So I just really would like to thank all those staff who've been working behind the scenes to make this happen. It's not just a case of where it's on order and let's wait for it. These people have been pushing every single day to make sure that we know we're getting this bit of equipment, where each bit of equipment was in the process. About getting the training online, so we know that we can do that training easily remotely, so our staff can be trained by the people who produce the piece of equipment and know how to use it. Nikki might be able to give more details about all the other little bits in there, but just to say this is happening sooner rather than later than we thought it would, because of the sheer effort that has been going in. And so that's where we are at the moment.
Great.
So this afternoon we've had a further case of COVID-19 on the island. I'm pleased to report that the person is doing extremely well. I'm also very pleased to report that we were able to identify the case very quickly. The case went into self-isolation. They have had minimum contacts, and as I said, they're doing really well. From our point of view, as I said to you some weeks ago, we identified France as an area of interest for us. We've always said that we need to use local data, look at what's going on in different countries, look at the proximity of those countries to us. And the latest case, in fact, had been on holiday in France some 10 days ago or so. So it was picked up in a timely manner. We are busy contact tracing. We heard about this case about an hour or two ago, and we're already deep into contact tracing, which we hope to finish in the next few hours. So I think this shows that this is a rapidly evolving situation. However, what I'd like to emphasize is that this is a case that came from France to us, so still is evidence of an imported case. So to date, we have no evidence of ongoing community transmission within our community. So an important development for us, and we'll carry on working into the evening on this to ensure that we get all the contacts and we give their contacts appropriate advice and quarantine information. They're being managed at home. As I said, they're doing really well, and we'd expect 80% of our cases to be managed at home, and I think that's really important. And we support people whilst they're being managed at home with daily safe and well phone calls and so on, and we try and make them feel that we are involved with them. Their GP, their primary care are also involved, so we provide a safety net of care around the person at home. Of course, should they need hospital admission, they absolutely will get admitted to hospital. So it's all about on providing the best possible clinical care for that person.
Clearly, the announcement that was made yesterday about schools, the information was committed to be uploaded today to provide further detail. The reason why we went out yesterday was to give as much advance notice as we possibly could, recognising both from a parent-guardian perspective, but also from the perspective of employment and employers. It was to allow people to have those conversations. So that information will now be online at gov.gg/coronavirus, and so there is information around what that looks like by way of key workers and who constitutes being a key worker within our community, what those arrangements should be, and it crosses all aspects of education for both state schools and independent schools, pre-school as well. So it gives a real range of information there, and there's also some frequently asked questions which we hope will provide that range of a range of sort of information that those who are out in the community who are seeking that clarity will provide. If I could just also take this opportunity just to reflect on some of the other information that we've provided, just to say that there are updates again. Please do check online. We know that from an essential workers perspective, around looking at those key roles within the bailiwick, that information again is online. If you think that you are a key worker to support our economy, our healthcare services, public sector workers, that information, that criteria is there. And there is a population management administering those, and we're triaging those applications, and they are being administered by experts around that essentiality. So please do look at that if that is relevant to you. The other key area that I would just like to mention is around the looking at the essentiality of making sure our healthcare workers is really key, and I think that's also relevant for our provision of ongoing school care going into the following weeks. And I think that what we are looking to also provide is potential care over the Easter holidays. So that's something that the Office of Education are continuing to look at, so we can ensure that criticality of workforce support as we go over the coming weeks.
So from our point of view, is we fully acknowledge that island life has to continue, but what we're asking people is to just take that extra precautions. So we're not saying to a 10-year-old child you can never see your friend for the next 5 months, but what we're saying is don't have a party with 20. So we're trying to limit those contacts, bring in enhanced hygiene, encourage people to look at alternative ways of greeting. So it's that whole island approach, but with a healthy awareness that this could go on for months. And what we want to do is keep the community on board as we give some hard messages. And I think from our proportion that community support is going to be key to how we manage that. So it's no doubt social distancing is one of the important mitigations for the flattening of the curve. And what we're looking is the flattening of the curve so that we know that we will see cases of COVID-19. We have seen cases. We always said our planning assumption was that we'd see cases. And so what we want to do is try and minimize those numbers of cases so that our healthcare infrastructure can cope. So I think it's reasonable to bring in sensible measures of social distancing, but we don't want to have social isolation.
Those who are over 65, those who have underlying health conditions need to take extra precaution and take special care. And a reiteration absolutely of the message that we've had throughout this so far. We will continue to review and make evidence-based decisions, the best judgment we can based on the latest information, latest advice. That is what's informing our decisions. But we can't, the decision wouldn't have been appropriate a week ago based on the information and evidence then. We can already see the impact that this is having on the community and our economy, and as Dr. Brink has said, we have to maintain the community have to come with us and stay with us on this journey. If we'd, it's quite an interesting experience, I think, certainly for us receiving regular contact from the public. We've got people at two ends of the spectrum. You've got those who, frankly, would have had us all marching around in hazmat suits back in January, with the whole island having been shut off at one end of the spectrum, and then at the other end of the spectrum you have those who say we've only got one case in the island, it's just the flu. Now neither of those ends of the spectrum are right. And what we're dealing with is making sure that the people in the middle are the ones that really understand that it's about balance. It's about balancing the public health risk and balancing the needs of us as a community, and that's what all of these decisions are based on.
As explained, we've got additional staff on tonight. There is absolutely no impact at the moment upon policing and the resources around policing. So we will be doing our normal licensed premises visits. I think the legislation is quite clear that quite a number of premises will be closed. Therefore, those that are open are going to be fewer, and we can do drop-in visits. That said, licensees predominantly in this jurisdiction work with us. We have confidence in them, and to become a licensee there are certain responsibilities. So very much the licensing trade in the main polices itself, because that's how the licensing system works, and we don't see any reason to undermine that. It's a very important aspect of what we're trying to do, and we from law enforcement will take action on any information to follow up to see whether there's any providence and legitimacy to that, and depending on the facts in consultation with our colleagues in health, I can assure you it will be followed up. You may have seen that one of the other Crown dependencies is well represented in the media of having actually arrested someone who they've obviously identified who had breached their similar legislation. So as the Chief Minister said, we work with the community. It's a community approach, but if you go against the law and you break what we're putting in place, obviously law enforcement is there to deal with that element of it.
Again, the speculation that we've, in some way would want to be concealing information from the public, I guess there's always going to be those conspiracy theories. It is not in anyone's interests that we should be doing that in any way whatsoever. So a real message of reassurance that we will get information out as quickly as we can, but recognising, as Jason has said, that sometimes you do need to communicate with certain people before other people. So there's a way to communicate, but there is no intention whatsoever to conceal any information. What we know, we will tell people. So thank you very much.
Yeah.